Good evening, everybody. I'm Dr. Ramanjit Singh. I'm Senior Consultant Dermatologist, Medanta Hospital. I'm also Director of Skincare Clinic, Gurgaon. Today, I'll be speaking something about chronic hair loss problems, which everyone experiences during our day-to-day practice. So, now coming to hair fall. Hair fall is a very, very typical problem. Some people consider some amount of hair fall as plenty, whereas to normal practice, if we see about 25 to 100 hair fall per day is certainly considered normal. So here are there in three different stages. Stage one is anagen, which is the growing phase. Then comes the catagen. Catagen is the intermittent phase, and then comes the telogen. Telogen basically is the resting phase. In this resting phase, there is definite shedding of hair, which is certainly normal. Some people experience more shedding, but others, for them, it may be less during this telogen phase. There's something called a telogen effluvium, which is a normal hair fall, which we, normal public, if they come to us, they say we have a chronic hair fall problem. This phase is called telogen effluvium phase. There are different causes of hair fall. Foremost cause is genetics. Genes play a very, very typical role for hair constitution of the younger people. If father is bald, then 90% of the patients, their siblings, they are definitely bound to get baldness, which would be in a stipulated age group. This baldness, this genes, however, cannot be changed, and this genetic baldness cannot be changed at all. But certainly with the help of certain chemicals, certain other treatments, we can definitely delay this hair fall. So hair loss hereditary, as rightly said, it is a definite problem. Question. Now, other reasons beside genetic factors, there are various other reasons for hair fall. Stress is another foremost and commonest reason for hair fall. Besides stress, smoking, then postpartum, following delivery, normal delivery, there is definite hair fall. Then chronic weight loss. Some people they go into chronic dieting, and with that also there is definite shedding of hair, definite shedding. Apart from that, thyroid plays a major role. Besides loss of nutrients, vitamins, they also play a very big role for growth of hair. So hair loss, and if you then consider hair loss and baldness, these are two different terms. Hair loss is chronic loss of hair, whereas baldness, if there is chronic loss of hair, then we can definitely point it to as baldness. Baldness is a definite loss and patchy loss of hair, which may be of various types. It can be because of the hormones. Say there is the excessive secretion of DHT, dihydrotestosterone, which helps in further weakening of the hair root and giving rise to a definite type of baldness, which is commonly seen in the frontal and the back side of the hair. This is something called the androgenetic alopecia. Besides androgenetic alopecia, some people experience a patchy sort of a hair fall, a patchy loss of hair, where hair becomes absolutely, the scalp becomes absolutely clean, the hair absolutely vanishes from those parts. There's something called alopecia. Alopecia, it can be of various modes. Again, basic cause of alopecia is it's an autoimmune disorder. So autoimmune, once a disease is autoimmune, then treatment changes for this autoimmune disorders. For alopecia, we have to have treatment in the form of steroids, and vitamins. Again, alopecia can be scarring and non-scarring. Scarring alopecia is the one where we have a definite loss of hair. There is loss of root also, and it doesn't normally respond to any form of modalities, any form of treatments. If the alopecia is non-scarring, then definitely we can treat this form of alopecia by giving steroids, immunomodulators, immunosuppressives, and application of steroids, application of irritants, and all those stuff. So, depending upon the different causes of alopecia, different causes of thinning, then our treatment also varies according to them. Now, coming to the vitamins, which all vitamins are good for hair? There are different vitamins. Foremost is iron. If somebody has iron deficiency, anemia, chronic anemia, then there is definitely hair fall. So these should be tested in the lab. Then if there is deficiency of vitamin B12, vitamin B5, which again can be tested. So we have to supplement them with the vitamins. Apart from this, if somebody has a thyroid problem, hypothyroid, which is very, very common, which is a medical problem, which leads to, again, chronic loss of hair, then we have to go for thyroid-related drugs. Now, we can definitely prevent hair loss. There are different modes of preventing hair loss. Foremost is we must try to keep our scalp as healthy as possible, as clean as possible. If somebody has excessive dandruff, we should use anti-dandruff shampoos. Apart from that, if somebody is anemic, we have to take care of the anemia. We have to give good iron supplements. Besides this, then vitamin K plays a very, very important role, and vitamin B12, which is in the form of vitamin B5, biotins, calcium. All these vitamins have a role to play for curbing a hair fall. So if we are able to take care of all these conditions, we definitely can attain a good, normal, healthy hair. So what is now female androgenetic alopecia? Female androgenetic alopecia is not a very, very common condition, but in some ladies we definitely see. Again, this is hormones related. Some people have polycystic ovary. This can lead to excessive shedding of hair, excessive thinning of hair, where baldness is visible in the scalp. Apart from that, DHT again plays a role. It again causes thinning of hair. It again causes shrinkage of the hair root, and it can certainly lead to a female type of androgenetic alopecia. Treatment, again, according to the nature of the hair fall, according to nature of the thinning, we have to give various supplements. We have to give them some form of injections also at times if it is very severe. These may be in the form of PRP. PRP is supposed to be a very good treatment if it comes to curbing of hair fall and hair loss, where we draw about 15 ml of human blood from the patient itself. It is centrifuged and plasma is drawn. This plasma certainly contains growth factors. Growth factors are injected at different points in the scalp, which now certainly is more or less a painless procedure, and it helps in reactivating the hair growth roots, so thereby improving hair density, and it also checks the shedding of the hair. So apart from chronic telogen effluvium, chronic hair fall, other uses of PRP we definitely use for facial rejuvenation. We use it for acne scars. We use it for diminishing fine lines and wrinkles. So it works wonders for skin and hair too. So treatment, as I've already mentioned, according to the type of hair fall, according to the type of alopecia, various vitamins in the form of vitamin B5, calcium, iron, then proteins. Then apart from that, if it is alopecia, then coming to the causes of alopecia, treatment has to be linked with that. If it is autoimmune, then we have to give steroids, immunomodulators, and if it is because of hormone related, then we certainly have to give hormonal therapies for the same. Thank you.